Hi everybody, it's Jason here. Today talking about my topic of EMDR and family therapy. Before anybody says anything, I know this is probably posted past 12 p.m., but today is a holiday, so we've been out from the university, and it's taken me a minute to be able to clear some space to sit down to be able to do this for today. So let's get started. I hope you've had an opportunity to read the two readings that I have posted for this. One is in a classic text of EMDR and family therapy process. Great book, has a lot of good chapters in it, but I have a few issues with that book because it's very surface level in many ways. It doesn't really look at how to intertwine EMDR as kind of an approach that can be integrated in family therapy with a variety of different populations. But it's a great reading that kind of broaches that topic. And the second one was published last year, 2018, and it has to do with using EMDR in combination with EFT for couples therapy where there has been an infidelity. And I thought that was a great place to start because a lot of times, let's go back. If none of you know what EMDR is, I've always walked forward thinking that most people do. But let's presume that you do not. EMDR stands for eye movement desensitization and reprocessing. And it's a form of trauma treatment that helps you reprocess traumatic memories into a more adaptive neural network. So it posits that we store memories in different neural networks. Traumatic memories oftentimes can be stored in our limbic system, which encodes the emotionality of the moment. A lot of what happened to you kind of gets encoded around that memory, so when you recall them, you're flooded with emotions, resulting in sometimes very discomforting situations. So what EMDR does is it uses bilateral stimulation to reprocess those memories into your adaptive neural network, which links up with all of your strengths and resources, a lot of times recognizing that in these other moments you were generally doing everything that you could. And it helps you, it flushes those heavy emotions out. You get rid of a lot of junk when you reprocess memories. So it's really an evidence-based practice for a lot of trauma. It can be used with a lot of different populations, and big T, little t traumas, and that sort of thing. So to kind of get started, if you've read the readings, part of what I want to talk today, my first point is a systemic disregard. That's kind of the first point, systemic disregard. A lot of times when I talk with family therapists about EMDR, I get this pushback that it's not systemic. And I have to pause there for a minute because systems theory looks at systems, multiple systems, not just a singular system, multiple systems. It evaluates who we are in different contexts. You at work is one system, you at home is another system, you with your partner is another system, and your thoughts are a system. What goes on up in here are a system. Now, this doesn't mean that I think that we can square mental illness away with systemic thought. I'm not trying to do that. What I am trying to do is to say that there are systems involved. And just because that one form of therapy focuses on one system doesn't mean it's non-systemic. And so I get a lot of pushback that it's not systemic. And so a lot of times therapists can disregard what's going on up here, trying to be systemic, disregarding this in favor of interpersonal. Now, if I have to be honest, 99% of the time, when you're dealing with something like anxiety, anger, things like this is going to have far more implications, far more efficiency in dealing with those issues than this. And I think that is a good place to focus here. I think that it's not a bad point to begin. But I think that we lose something when we think this is all that matters, that nothing else matters but this. And so I think that we disregard systems because it doesn't fit what we've been told or our beliefs. And in this way, we honor a theory and not our client. And so I think when it comes down to this type of intervention, when it comes down to EMDR You can bring in CBT or any type of intrapsychic process. I don't use those typically because I don't think they're as efficient as interpersonal, me focusing how I am with another person. Trauma is a different animal. The scars trauma leaves behind, physical scars on your neural networks, on brain, on the way that your brain processes information, is very real. It's not something that exists abstractly. We're not talking about mind wounds. We're talking about brain wounds. And in a lot of these cases, sometimes it's hard for MFTs to connect with that because we like systems. And there's nothing wrong with systems. I'm a huge systems fan. It's just it's not the only game out there. Okay. So when we get down to talking about systemic disregard, I think the first point is that a lot of MFTs disregard this system. And oftentimes in therapy, you don't have to focus on what's going on up here to be successful here. That's fine. In the case of trauma, I think you're putting yourself at a serious disadvantage if you disregard what's going on up here. There are a lot of times that no matter what goes on here, combat vets are a perfect example. No matter how you shape family and couple situations, buttons exist up here that you can push that can set someone back. And so I think that in this way, we cannot disregard the intrapsychic system. Okay, my second point is everything can be systemic. Everything can be. Psychiatric medication can be systemic. So I want you to think about this. If you were a psychiatrist and you had just prescribed an antidepressant for an adolescent that has depression. And now imagine that I'm a family therapist who gets that case and you tell me, listen, I give this in, work this into your treatment. And I say, okay, I can make that systemic. I can use psychiatric medication as a systemic intervention. And let me explain. So let's say that I assess the family system and you have a dad that is that is disconnected from the family, that oftentimes is unresponsive to the family meeting their certain needs. Mom is over involved with the child, and a lot of times at this age it can create what we call depression. So if I'm using this pill, one of the ways that I can use it in a systemic way is how it's given. So if I turn to this family and say, listen, the boy really needs his father to model this type of behavior. We need him to come in and give this pill to this child every morning at 10 a.m. And after that, because this pill needs to circulate in the blood system, the father should take this boy on a walk, for 45 to 50-minute walk around the neighborhood to get his blood circulation, to make sure that this medication is working properly. 10 a.m., 7 a.m., you name it. I know it sounds early, but I'm imagining that he goes to school, maybe in the PMs. Time doesn't matter. Just follow me here. In this way, I'm getting a father who is disconnected from the system, not completely uninvolved. I'm getting him involved. I'm changing the dynamic. And if mom pulls back, if then dad and son start to bond, he might start feeling better because we're changing the dynamic. And so in that way, you're doing a systemic intervention using a psychiatric medication. Anything can be systemic. So let's stretch our minds a little bit here. EMDR can be systemic by the way that you give it. If you work this into your practice in a way that is trying to challenge dynamics, you're being systemic. You're using it in a systemic way. You're bridging what's going on here with what's going on here. I think that's important because I think, especially with trauma, which I'm more and more interested in trauma, especially with trauma, it gives us more tools to work with more severe problems. And so since everything can be systemic, you're not violating any type of theoretical principle that you agree with. Now, I always advocate for you guys to be critical in the way that you are assessing what you're doing and what's working, and pragmatic. I don't want any of you married to a single theory, because if you're married to a theory, oftentimes the people that are hurt are your clients, because you're going to pick your theory over your client every time. I would rather have you pick your client and whatever works best. That's being pragmatic. Okay, the third point is addressing both and is required. So once we start realizing that you can use these things in a systemic way, addressing them in a both-and way is required to be successful. So I'm giving an example here of a combat vet who comes home from combat, has PTSD, and has now caused secondary trauma into the family because now everybody there is on edge. It's affecting their life negatively. So if I could work with the combat vet individually, but my guess is that that would only reduce secondary trauma in the family by a marginal amount. I think that if you loop those families into the EMDR treatment, if you have the spouse be present, especially to help bring the vet, because if anybody has ever done EMDR therapy, there are moments whenever people can have an abreaction. They can have a flooding of emotions. They can disassociate away from the present moment to a moment in the past. Now imagine if you have somebody that they have a strong attachment to there in the room that can bring them back to the present. They can help expand their window of tolerance for what they can tolerate in those sessions. All of a sudden you're cooking with real grease here for moments in which these people have flooding emotions. Okay. I think when we're talking about both and is required, I think that if we want to see true significance in our work, especially with trauma, helping create those moments that they are reprocessing those memories as moments to increase attachment to their significant other, to their parents, to their family systems. Increasing that attachment at the same time is a systemic intervention. It's not just an intrapsychic intervention, and you can't do that with EMDR alone. So this isn't a pitch to have one singular form of therapy. It's a pitch to have integrate this as to address one system while addressing another. You can do both at the same time. That's why we're both and, not either or. My last point is EMDR with vets, because I think I currently see vets now. A lot of them are starting to request EMDR because it's starting to grow in popularity about reprocessing these events, helping them become more comfortable in their own skin, to reach the goals that they want to have. I think that's great, but I think it also doesn't loop in the damage that's been done secondarily with their family, with their partners, with their spouse. And so I think bringing those members in as well, creating a context of which that you can bring, that they can be as a resource in the moment when this reprocessing is going on, is going to increase your effectiveness. So that's kind of where I'm at today with this topic. I am actively exploring its use in couples therapy with vets to see about having a significant other used as an attachment kind of anchor, so that whenever they disassociate, that person can bring them back. And in these interactions of which that they are being relied upon as a resource, it's going to increase their attachment. The partners are being shown that they have a significant impact on the combat vet when they're having these abreactions, that they're not helpless, they're not hopeless, the situation isn't hopeless, and that things can change. It also shows the combat vet that when you rely and reach out, you actually, not only do you feel more successful, your partner and your family can feel more successful. They can feel more hope. Positivity around this issue increases. And so in this way, it has the ramifications of treatment are quite extreme. There's a lot of ways that this can go. And so I think where I'm at is how do we work this in? One, how can we do it? And I know that theory fights are not limited to MFT alone. They happen in psychology. They happen in the EMDR field. I'm told conferences at EMDR every year can get pretty livid between people who change just one little thing about a protocol. So it's not something that's unique to MFT, but I think that being both and, that systems theory and thinking is rooted in both and considering external factors and the influence they have on a variety of aspects of life should preface us to be more open to other things, not closed. I'm going to end with this. There is nothing that is more non-systemic than claiming that something else isn't systemic, because that shows that you're in an either-or mentality. that you don't know how to incorporate that into challenge systems, that you can't work anything in your interventions. In the end, you limit yourself to your specified comfort zone. And oftentimes that can close off pathways for your clients to be successful. So that's it. I want to appreciate you watching my video, and I hope all of you have a wonderful Monday. And please leave comments. I will respond as often as I can. Oftentimes it's a couple times a week due to my responsibilities here. I am always responsive to emails. Please email me if you have any questions. You guys have a great week.